There are a few reasons to pay attention to your alcohol use if you've been diagnosed with a mental health condition. One is that alcohol can actually worsen some mental health conditions. If you have depression, alcohol can actually make your depression worse. And initially, when we start drinking, we may feel like it's boosting our mood, but over time, it can actually make us more depressed. The same is true for anxiety. For a lot of people, alcohol helps to reduce anxiety in the moment, but over time, it actually makes our bodies more anxious, and we're not able to cope with anxiety on our own. My name is Dr. Laura Erickson-Schroth. I'm the Chief Medical Officer at the Jed Foundation. Today, I'm going to be talking about alcohol use and its connection to mental health. A lot of people enjoy drinking because it makes us feel calm and relax or boosts our mood. But where we get into trouble is where we rely on alcohol to do those things for us. Alcohol can make mental health conditions worse. Alcohol is technically a depressant. And if we're already depressed, it can make us more likely to act on suicidal thoughts. Alcohol can make anxiety worse over time, though in the moment when we're drinking, we might feel more relaxed and calm. Our brains compensate over time and we become more anxious. People with anxiety who drink need more and more alcohol over time to have the same effects. Alcohol can also lower inhibitions. It can make us do things that are more risky or engage in behaviors that we wouldn't normally. Alcohol can interact with medications that we take for anxiety or depression. It can make them less effective, or even in some cases, combine to make us more likely to have medical issues like seizures. Sometimes drinking can be one of the signs that we have an underlying mental health condition. Heavy drinking can indicate that we have depression or anxiety underneath. Sometimes it can be one of the first things that we notice when we or someone else that we know is experiencing depression or anxiety. If you're worried about your alcohol use, there are a number of different things you can do to approach treatment. One of them is to reach out to a peer-led support group. That includes things like AA, Smart Recovery, and Moderation Management. There are also professional-led support groups with people leading them who have experience working with people with substance use disorders. There's also individual treatment where you can get either individual therapy to explain the reasons around your alcohol use, or you can get medications that may help you with the cravings for alcohol. Finally, if you're feeling like you're going into alcohol withdrawal and it's getting worse, you should seek out medical care by going to an emergency room for your alcohol withdrawal. For more information, visit Jed's Mental Health Resource Center at jedfoundation.org/help.